Outpatient Autologous Stem Cell Transplant for patients, family, and caregivers. An autologous stem cell transplant is a medical treatment that replaces a patient's bone marrow with their own healthy cells. Before patients start their treatment, there is certain information that is important to know and will help patients, family, and caregivers prepare. In this video, we will discuss what a stem cell is, go over a generalized timeline for an outpatient autologous stem cell transplant here at Moffitt Cancer Center, and provide details on how to prepare and what to expect. So what happens with an autologous stem cell transplant? First, bone marrow and cancer cells are destroyed with high-dose chemotherapy, or what is often referred to as conditioning chemotherapy or treatment. The patient then receives a stem cell transplant after conditioning therapy is complete. We then wait for these new cells to begin to grow, or what we call engraft, and create new bone marrow in approximately, or on average, 10 to 12 days. This is just a brief overall summary of the process, but now let's go into the details. So what is a stem cell? A stem cell is an immature blood cell that can develop into one of the three types of blood cells we have in our body. Those cells are red blood cells, white blood cells, and platelets. After the transplant is complete, we wait for new cells to grow and focus specifically on a type of white blood cell called a neutrophil. Neutrophils are the first type of white blood cell to respond to and help protect the body against infection. This is a generalized timeline of an outpatient autologous stem cell transplant. During the initial visit, the patient will meet with their primary blood and marrow transplant doctor and team, often referred to as BMT team for short. After the initial visit, the blood and marrow transplant team will develop a treatment plan, which includes conditioning chemotherapy and timing for transplant, along with vital organ testing. The vital organ testing can be in different departments and different locations at the cancer center. And the purpose of this testing is to make sure the patient's body is ready for transplant. After testing is complete and patients are deemed ready to move forward with transplant, patients will have an appointment with their BMT doctor and review the test results and sign consents. Next, a central line will be placed, which will be discussed in more detail shortly. Once the central line is placed, the patient's stem cells are collected, frozen, and stored until the day of transplant. The next step is the start of conditioning therapy. We have a numbering system that we use in transplant, and the day that chemotherapy starts begins on a day minus number. The number itself depends on the chemotherapy regimen the medical team has ordered. For example, a patient may be admitted on day -5, and then we count up and finish our negative numbers prior to the transplant day, which is actually called day 0. The day after transplant is day +1, and we can continue to count each day. After the stem cell infusion, we wait for the new cells to begin to grow or engraft and create that new bone marrow. Autologous transplant patients on average engraft anywhere from day +10 through day +12 and are required to stay locally or close to Moffitt Cancer Center until day +30. This is a lot of information and provides the big picture, so let's talk about it in a little bit more detail. After the initial visit and when vital organ testing is complete, the patient will have a central line placed. A central line is a hollow plastic tube that is placed in the chest and tunneled under the skin. It is used for collection and infusion of stem cells, chemotherapy administration, drawing blood samples, administration of IV fluids, administration of IV medication, and any transfusions as needed. The procedure to place a central line is done in the outpatient radiology department and takes approximately 45 minutes. Because this is considered a surgical procedure, patients will receive further instructions regarding preparation. In most cases, patients receive light sedation, so they will need someone to drive them home after the appointment. Ice packs will be provided and often help with comfort and swelling. And the medical team will let the patient know what medications can be taken for pain if needed. The line will be placed in the patient's chest, on the opposite side of the patient's chest if they currently have a port, and will have two external tubes or what we call lumens. The nurses in the BMT treatment center will care for the line by flushing it and changing the dressing. The dressing will be changed every 7 days and as needed. The dressing will also have to be covered when the patient showers to protect it from getting wet, and the nurses can show the patient how to do this. The line will stay in place throughout the transplant, and the doctor will determine when it can be removed. Typically, lines are removed close to day plus 30 or before returning home. Patients will then be scheduled for apheresis, the stem cell collection itself. This procedure is done in our outpatient apheresis department, and the patient will be connected to a specialized machine, shown in the picture, that collects the patient's stem cells and returns the remaining blood back to the patient. Prior to this procedure, mobilization of stem cells from the bone marrow is required. This is why patients will receive growth factor injections once a day for 4 days after 5 p.m. Prior to collection, we ask patients to start hydrating well by drinking plenty of fluids 3 to 4 days before cell collection. On the day of stem cell collection, patients should arrive at the apheresis department at their scheduled time. The collection can last up to 8 hours and can range between 1 to 3 days. It is important that patients have a good breakfast the morning of the procedure and that they bring any medication that needs to be taken that day with them. Patients may bring snacks, laptops, books, phones, headphones, or iPads or tablets to pass the time if so desired. TVs, warm blankets, bedside commodes, and urinals are available. Food and beverages are also available. After the procedure, the patient's cells are processed by the cell therapy lab at Moffitt Cancer Center. They are frozen and stored until the day of transplant. If additional days of collection are needed, the patient will receive another growth factor injection, again after 5 p.m. The nursing staff will inform the patient if this is needed. Patients, please make sure to drink plenty of fluids and have a good dinner the evening of your procedure. Once stem cell collection is complete, the patient's next appointment is often the start of chemotherapy. Each patient will have a treatment plan that is determined by their primary BMT doctor, and these appointments will be in the BMT CI treatment center. The chemotherapy will be given over 1 to 6 days, depending on the treatment plan. Scheduled nausea medications are given prior to the start of chemotherapy, and additional medications are available as needed. One of the chemotherapy drugs that is often used in conditioning therapy is called melphalan. The nurses have orders to bring patients ice chips to keep their mouth cold. Patients will be asked to hold the ice chips in their mouth and allow them to melt for 5 minutes before the start of the melphalan infusion, during the infusion, and also for 15 minutes after the end of the infusion. The reason for this is that doing this has shown to decrease the severity of mouth sores, a potential side effect of chemotherapy. After the days of chemotherapy are complete, the patient will have what's called a rest day on day -1, which means no chemotherapy is administered. Chemotherapy can be excreted through body fluids. For example, stool, urine, vomit, and is important to follow home chemotherapy precautions. Home chemotherapy precautions begin the first day of chemotherapy and continue until 5 days after the last dose of chemotherapy was completed. Caregivers should avoid contact with patients' body fluids by wearing gloves when handling dirty linens or clothing. When linens or clothing become dirty, wash items separately once before washing them with any other laundry. Caregivers should also be sure to wash their hands before and after providing any care to the patient. Patients should make sure the toilet seat is clean and dry when they sit to urinate. The toilet lid should be closed prior to flushing to avoid any splashing. Please flush once. If after flushing once and anything is still seen in the toilet, such as stool or urine, the lid should be put down again and the toilet flushed again. Both patients and caregivers must wash their hands with soap and water after using the restroom. Once conditioning therapy or chemotherapy is completed, it is time for transplant day, which is completed on day 0. The stem cell transplant and or infusion will be completed in the patient's room in the treatment center. Pre-medication, such as Tylenol or Benadryl, are often given to prevent reactions. Reactions could be due to the preservative, referred to as DMSO, that was added to the cells so they could be frozen. Patients may also receive IV fluids before and or after the transplant. The length of time it takes to complete the transplant depends on the number of bags patients will receive, which is determined by cell count and processing. The nurse stays with the patient the entire time and will take multiple sets of vital signs during and after the infusion, along with monitor for any side effects. Patients should report any new symptoms to the nurse right away. After transplant day, or day 0, we start to count up. As mentioned previously, day +1, day +2, and so on. This is when we are waiting for engraftment, for those new cells to begin to grow. Red blood cells, white blood cells, and platelet counts will begin to drop, however, after conditioning therapy, which is expected. These counts will then begin to rise when new blood cell counts form, and this is what we call engraftment. The first cells to usually return or to start to rise or come up are white blood cells. Next in line, red blood cells, and finally, platelets. However, each patient can differ. As we wait for engraftment, patients may experience the side effects of conditioning therapy and any complication of transplantation. Common side effects of conditioning therapy include nausea and vomiting, diarrhea, decreased appetite, mouth sores, hair loss, pain, fatigue, changes in memory and concentration, decreased blood cell counts, and possibly infection. Patients may experience one of these, several of these, and or all of these side effects. It is important that patients communicate to their nurse and medical staff about their symptoms when they occur, so we can help with symptom management. Nausea and vomiting can start at the beginning of chemotherapy. There are different therapies and medications available to treat nausea and manage this side effect. If patients experience diarrhea, the medical staff needs to know. If it is liquid, watery stool, the medical staff will need to obtain a sample and send it to our lab to test for infection. There are also medications to help manage this side effect. Patients can often experience decreased appetite due to nausea and vomiting and or even taste changes. There is a dietitian available to assist any nutritional needs. It is important to get enough nutrition and stay hydrated during this time for the body to stay strong. We will monitor everything patients eat and drink to make sure their body is getting what it needs. We may need to give patients IV fluids to assist and prevent dehydration. Mucositis is the medical term for mouth sores. Patients may experience mouth sores in their mouth, on their tongue, and or lips, and sometimes even their throat. That can often make it difficult to swallow. We have mouthwashes to use for comfort, and some people may need pain medication to help until these sores heal. Hair loss usually occurs around day plus 10 or 11. The nurses can help make arrangements with the salon employees to come to the patient's room and have their head shaved if they would like. Fatigue is one of the most common side effects and can often take a while to recover from. The best thing patients can do is to stay as active as possible, taking walks, staying out of bed, working with physical therapy as scheduled will help all of this. Patients' blood cell counts will decrease as a result of conditioning therapy, which is expected to happen, and will put the patients at a risk for infection and potential bleeding risk. As mentioned, pain can be a potential side effect experienced during this treatment, from possible mucositis, abdominal pain, body aches, bone pain, and potentially chronic pain. It is okay for patients to use pain medication to control pain. The medical team will manage these medications, and doses can be adjusted to reduce possible side effects, if any. Our goal is to keep a patient's pain at a comfortable level. So it is important that patients communicate to the medical staff when they are experiencing pain. Decreased blood cell counts are an expected side of conditioning therapy, as mentioned previously. With the white blood cells, we are focused mainly on the neutrophils, which is a type of white blood cell that can respond to infection. When patients' absolute neutrophil count, or ANC, drops below 500, patients are considered neutropenic and at high risk of infection. Red blood cells are what carry oxygen to the body and are measured in hemoglobin. If the patient's hemoglobin drops below 7, the patient will require a blood transfusion, unless otherwise specified by the medical team. Some patients may require blood transfusions prior to dropping below 7. Platelets help prevent bleeding by helping the blood clot. Bleeding risk increases when the platelet count drops below 50. It's important that patients report any sign of bleeding, for example, a bloody nose or any gum bleeding. When the platelet count drops below 10, patients will need to receive a platelet transfusion. When the blood cell counts, or more specifically, those white blood cell counts begin to drop, patients are at high risk of infection. Infection can occur anywhere in the body, but patients will receive medication to either help prevent infection and often treat infection, such as bacterial, viral, and or fungal infections. Nurses and oncology technicians will be checking the patient's temperature and vital signs at each appointment. If a patient has a temperature of 100.4 or higher, the nurse will start what is called fever protocol. Fever protocol is the term we use to describe a list of things the medical staff will need to do if or when a patient has their first fever. This includes drawing blood cultures from the patient's central line or port, or even a possible IV stick. A chest x-ray will be done, and the patient will be asked to provide a urine and stool sample to look for the possible source of infection. Sometimes there is a specific source of infection. However, there are different things that can occur that cause fevers during transplant. We will treat the patient as if there is a possible infection, regardless while their new immune system and our cells are still growing and we look for a source of infection. Due to these low cell counts, and as mentioned already, patients will be at high risk of infection and possibly at risk for bleeding. Both infection and bleeding infection precautions start the day of admission or start the day chemotherapy starts. Hand washing is expected of everyone. Everyone entering the blood and marrow transplant clinic and or treatment center is required to wash their hands, either with soap and water or hand sanitizer. No one that is feeling sick or ill or has been exposed to anyone with contagious disease should visit. No fresh or dried flowers and or live plants are allowed. We ask that patients remove any gel, artificial nails, and or piercings, with the exception of earrings. If patients use contact lenses, they should bring their glasses and not use contact lenses during this time. To prevent bleeding, soft toothbrushes will be provided to the patients, and they will receive a new one every 7 days, starting 48 hours after the last dose of chemotherapy is completed. No flossing, toothpicks, or water picks are allowed. If patients are on blood thinners, these medications will be stopped when the platelet count drops below 50. We ask patients to try to avoid blowing their nose forcefully and to use electric razors only. It is also important for patients to trim their fingernails and toenails prior to admission and do not bring clippers to the hospital. If needed, a file or emery board will be provided. The number one way to prevent infection is hand washing. Anyone coming into contact with the patient should be washing their hands. Anyone that enters the BMT treatment center or clinic or inpatient units are required to wash their hands or sanitize at the door before entering each time. There are several examples of when we should be washing our hands, but there are many more. Technically, there are two ways to wash our hands. First is soap and water, and the second way is with hand sanitizer. Hand sanitizer is great and convenient to keep in the car, in your purse, end table, or anywhere. However, soap and water is required to be used after you use the bathroom and or if your hands are visibly dirty or sticky and greasy. When in doubt, just wash your hands. Continuing with infection prevention, it is important that patients avoid crowds and handshaking. Patients will be asked to wear masks in public. This includes coming to appointments at Moffitt Cancer Center. Also, no sick visitors or those that have been exposed to contagious disease should visit the patient. Patients should avoid contact with human or animal feces. Animals like birds, reptiles, rodents, zoos, farms, and barns. They need to also avoid contact with soil, lawn waste, grass, so no gardening or mowing during this time. No hunting, horseback riding, fishing, and or swimming. And patients should also avoid construction sites, carpentry, handling of chemicals, and any illicit drugs. Patients should also use caution with pets. As previously mentioned, patients should not clean up after pets, so no cleaning the litter box, for example. Patients should decrease pet exposure to face, such as licking. Pets should not sleep in the patient's bed, and patients should be washing their hands after feeding pets, handling pet treats, or petting a pet. For any pet-related injuries, such as a scratch or bite, the patient should wash the area with soap and water and let the medical team know if there are any openings in the skin. Patients will have daily visits to the BMT treatment center during their outpatient autologous stem cell transplant journey and will be provided a designated time each day for when to arrive. Both patients and their caregiver are expected to both attend these appointments. For each of these appointments, the patients are asked to bring with them their completed patient diary, which will be discuss next, all medications and their medication list that will be provided to them. During these appointments, patients may require medications, IV fluids, and or transfusions depending on the lab results each day, but this will be determined daily. Plan to be in the treatment center for most of the day until these things are completed. This is a picture of a blank patient diary. Patients will receive a blank diary each day to fill out to the best of their ability and bring back the next day at their appointments. These diaries help the medical team monitor what the patient is eating and drinking, what symptoms they may be experiencing, and any other notable items that need to be discussed. When coming to these appointments, hand gel or sanitizer is located next to the entry doors and must be used by everyone who enters. Children under the age of 12 are not permitted in the inpatient or outpatient treatment areas or clinic. And only one visitor should come with the patient to these appointments. As mentioned, these appointments may be long days, so it is recommended to bring a laptop, book, or small craft to pass the time. Snacks and drinks are available in the treatment center, but patients or caregivers may also bring their own if it does not require refrigeration. Patients during this time are expected to check their temperature every 4 hours when they are awake and write those temperatures on their diary. If a patient's temperature reaches 100.4 or higher, they should report this to the medical team. We will discuss shortly how to contact the medical team. Patients are also expected to wear sunscreen, SPF 30 or greater, every day to report any skin changes or rash to the medical team also. Patients should shower daily using the CHG HIPAA Cleanse soap they will be provided. Protect the central line in the shower, and make sure to use a clean towel and washcloth each time they shower. Patients should also change their clothes daily and practice good oral hygiene. Oral hygiene or oral care is an important part of infection prevention. The mouth contains many kinds of bacteria, so performing mouth care, such as brushing your teeth, cleaning dentures or partials, and using oral rinses will help keep the mouth clean and moist. Patients will be provided soft toothbrushes, alcohol-free mouthwash, toothpaste, and petroleum-free lip and mouth moisturizer. Patients should brush 4 times a day, after meals and at bedtime, and after vomiting. If patients are experiencing increased vomiting, mouth sores, or are currently not taking anything by mouth, this schedule may need to change or increase. The nurse can help the patient determine what is best. Personal hygiene, like oral care, is an important part of the patient's daily routine to prevent infection. CHG, or HIPAA Cleanse, is provided to patients when they start treatment as either a soap to be used in the shower or as a wipe. CHG is a medication for skin that helps prevent infection. Either the CHG soap provided or the wipes must be used daily, unless, of course, the patient has a reaction or is sensitive to these products. CHG soap is applied directly to the skin and rinsed in the shower. CHG wipes, on the other hand, can be used in place of showering and do not require rinsing. CHG should not be used on the patient's face. A medication list will be provided to the patient, and it is important that this list be brought to all appointments. Also important that if any medications change, that patients obtain an updated list prior to leaving the appointment for the day. Patients also need to bring all their medication or medication bottles with them to appointments in case they need to take them while they are receiving treatment that day. Patients should get permission to take any medication, even over-the-counter medicines, if it is not on their current medication list. Once the patient has engrafted, there will be less frequent visits to the BMT treatment center. So the appointment times can change and may not necessarily be every day. After engraftment, patients will no longer have to complete their patient diary, but will stay close to Moffitt Cancer Center until approximately day plus 30 to continue to be monitored. A caregiver is required during this treatment and this time 24 hours a day, 7 days a week. The patient should not be left alone. Technically, caregivers are required from the start of chemotherapy until approximately day plus 30. It is recommended to have more than one caregiver or a backup caregiver to help, but each caregiver must attend a class to learn how to care for the patient during this time. Caregivers have several responsibilities and are part of the care team. It is important that patients and caregivers communicate well and communicate with the medical team. Some caregivers' responsibilities include monitoring the patient's temperature, monitoring for any symptoms or side effects, helping manage medications, and of course, helping to prevent infections. Caregivers will need to drive and come with the patients to their appointments, do housekeeping, and also prepare meals. It is important that caregivers also take care of themselves and ask for help when needed. If a caregiver gets sick or ill, they can no longer be a caregiver until they are symptom free. We do not want anyone sick or exposed to contagious disease near the patient. Caregivers, if you develop a fever, cough, runny nose, sore throat, nausea, vomiting, or diarrhea, contact a backup caregiver right away. Stay with the patient until they arrive, and then go receive medical treatment if needed. Caregivers and visitors should be symptom-free of any illness and or have a doctor's note to return as a caregiver. Another important aspect of infection control and prevention is cleaning. The patient is not allowed to do any housekeeping and should avoid being in the room while it is being cleaned. Caregivers can help minimize exposure to dust and fumes by dusting with a damp cloth and not cleaning when patients are in the room. The eating area and bathroom should be cleaned daily, floors vacuumed and mopped weekly, and the sheets and pillowcases should be also changed weekly. Preparing meals is another role that caregivers can fill during this time, and it's important that patients and caregivers practice food safety. Patients will be provided diet guidelines. However, a good way to look at food is with the 4 steps to food safety, another way to prevent infection risk. Number 1 is to clean, making sure everyone is washing their hands, washing produce, washing utensils, and cutting boards before and after use, and washing or cleaning off the top of canned goods before opening. Number 2 is to make sure to separate food. Keep raw meat, poultry, seafood, and eggs separate from other foods. Use one cutting board or plate for raw foods and another or separate one for other cooked foods. Number 3, cook to safe temperatures. It is recommended to use a food thermometer to measure the internal temperature of all meats. No sushi or rare steak are allowed at this time. And number 4 is to chill and refrigerate. Once meats, eggs, or any perishable items are purchased or have been cooked, make sure to chill and refrigerate them within 2 hours max. As caregivers, it is important to also monitor for symptoms after discharge. Patients should communicate with their caregivers what they are experiencing. Please call 911 for any emergency. For other questions or to report symptoms the patient is experiencing, call the BMT clinic at 813-745-7208. This number is 24 hours a day, 7 days a week. It is important to always call first and speak with the medical team to get further instruction. Thank you for watching our video today on outpatient autologous stem cell transplant at Moffitt Cancer Center. This video is not a substitute for required scheduled classes for both patients and/or caregivers. The content is not intended to be medical advice, and the viewers should consult their physician should they have any questions. Viewers should not rely on information contained in this presentation for immediate or urgent medical needs. If you think you may have a medical emergency, call your physician, go to the nearest emergency department, or call 911 immediately. Never disregard professional medical advice or delay seeking care because of information contained in this presentation.